high-throughput screening facility at the SPARC Biocenter, which is part of the Hospital for Sick Children. Today we're running an enzymatic assay, which means we have protein, which is an enzyme, in a plate that looks something like this, or exactly like this. 384 wells. You can just see those little squares. Each represents one well. So we've preloaded the enzyme solution, or the protein solution, into each of those wells. And you can see those plates, the black plates, are stacked on the carousel here, waiting. Now on the middle here of the screen, you can see a clear plate, and that has the compounds in it, or the drugs that we're going to be testing. And the reaction is that a substrate will be added to the enzyme, and if the enzyme is working, it will turn over the substrate and create the product. And the product has a different fluorescent signal than the substrate, so we'll be able to detect that reaction. And if one of the drugs inhibits the enzyme like we want it to, then the substrate will not be turned over to the product, and we'll be able to detect that absence of signal, and we've identified then a drug that can inhibit the enzyme. The first step in this is the drug plate is going to have its seal taken off in this instrument, which is called an X-peel. Right now it's sealed to prevent evaporation and absorption of water into the DMSO solution that the compounds are in. All right, so there the plate has entered the X-peel. It's going to have its seal removed. This is so that the instruments can get access to the compounds which are inside that plate. Now that plate is going to get moved to an instrument called the Echo 550 by the robotic arm. And this instrument actually dispenses the compounds using acoustic sound waves. And it transfers 2.5 nanoliters at a time. A nanoliter is 1/100,000th of a milliliter. So there goes the compound plate to the Echo. And there's a different compound in all of the 384 wells, with DMSO controls in the first column, second column, and the 23rd and 24th column. This instrument can dispense the drugs very quickly and much more accurately and in much smaller volumes than we could do by hand. Right now the plate is in there. The instrument is just figuring out how much of each compound is in each well so that it knows how much force to put on the wells to transfer the drugs. This instrument here is about worth $500,000. Okay, so now the robot is ready to accept the reaction plate, the black plate. The robot takes the next plate off the carousel, and it's going to remove the lid. The second robotic arm does that. Places the lid on a platform for storage. And now the reaction plate will get put onto the Echo 550, and this plate actually gets turned upside down, even though it already has liquid in it. So it's the surface tension that keeps the liquid in those small wells. Right now there's 25 microliters in it, and we can do about 50 and safely turn it upside down. Now the compound is being dispensed into each of the wells. Sound waves hit the compound from underneath, and 2.5 nanoliters of compound get transferred up and into the destination plate. So the destination plate has to be upside down. Okay, so out comes the drug plate, and it's going to go over to the other side of the system and get a seal put back on. So you can just see way off in the distance, it's being put into that instrument, and it's going to have a seal added. Now out comes the reaction plate, and this is going to get moved to a shaker. And it'll be shaken for a few seconds, and this is just to ensure that the compounds we've just added to the enzyme solution get fully mixed in. So there, the compound plate has been sealed, and it comes back to be stored in the carousel until the entire run is over. So this plate will get relidded, and it will go sit on the carousel for 10 minutes. And this is to allow enough time for the compounds to bind to the enzyme so that it can block the reaction later on during the experiment. Alright, so it'll move that plate onto the carousel, and it'll sit there for 10 minutes. Now a plate is being brought over to have substrate added. So after it's sat with the compounds added for 10 minutes on the carousel, then it needs to have substrate added. And the addition of the substrate is what actually starts the chemical reaction. When the substrate comes in contact with the enzyme, it will be turned over to product, and if the drug stops that interaction from happening, or stops the enzyme from turning over the substrate, then the reaction won't happen. We won't see an increase in fluorescence, and we'll know that we've identified an inhibitor. So this instrument has a super fast injector. Just see, it has 8 ports, and they go across the plate, and then it goes back across the plate to get all 16 wells of the plate. There's a quick little shake, and then that plate will go back to the carousel and sit for about half an hour until it goes into the plate reader. Now plate number 4 will be moved over to the plate reader, and its read will begin. The plate reader will read each well 4 times, 90 seconds apart. And this way we can see the rate of the reaction, not just one time point, but we can see how it changes over time, which is a rate. So there's, from the opposite angle, the plate being moved into the reader. And that tick, 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 tick is the plate reader reading each well individually. And that pretty much ends the process.